Good afternoon, everybody, and welcome to today's webinar. Just a couple quick housekeeping items before we begin. During the session today, if you have any questions, feel free to enter those questions in the question box on your screen or use the raise hand icon to let us know that you have a question. Other than that, we just hope you enjoyed today's content. Now I'll pass it over to Altius CEO, Stephanie Dormer.
Thank you all for joining us today. Altius is very excited to share this information with you and to talk about the 12 days of productivity. Today, we're going to focus on a few different things. We're going to start, number one, with sharing a little bit about who Altius is and what Altius Healthcare Consulting Group does. Then we're going to move into a very quick overview of productivity for all of those of you that may not be familiar with productivity. And then we're going to get to the heart of the webinar, which are the 12 days of productivity. We really wanted to put together a fun, festive theme and present productivity in a little bit different manner to make it easier to understand and to have some festive holiday celebration and fun with the theme. We'll then conclude with some thoughts and leave ample opportunity for questions and interactions and response. So first, for those of you that are unfamiliar with Altius, Altius Healthcare Consulting Group is a healthcare consulting company that focuses on improving the financial and operational performance of hospitals, healthcare systems, and healthcare organizations. We really are in business to ensure that our clients have the right person in the right place at the right time for the right clinical outcome so that they can deliver on their mission of providing the highest possible quality of care to the communities that they serve. We do this by providing services in a few different areas. Primarily, we focus on workforce optimization, labor management, and productivity. However, we also provide services in the areas of physician practice management, interim executive placement, as well as areas such as benchmarking and management support. Altius is known in the industry for a proven 10-to-1 return on investment. Now, I know you're thinking, wow, that seems really high. But we've been able to successfully deliver this over extended periods of time for our clients. And more recently, we've really been looking at the return on investment over the course of our client engagements. And we have engagements as high as 30-to-1, 17-to-1, and in the first year, as I mentioned, we successfully deliver 10-to-1 year over year. We will also guarantee a 20-to-1 ratio of assessment fees to actual opportunities. We do not believe in waiting until the assessment is over to start improving your facility. We start right away. So change begins immediately, and we can support all size facilities, ranging from critical access hospitals to individual practice managers, as well as large healthcare systems. And regardless of what software you may currently have in place, we can provide you and augment anything that you're currently doing. More importantly, we're going to help you drive systematic accountability through performance improvement. The Altius mission is to improve the operational and financial performance of our client hospitals through realistic solutions that achieve lasting results. And what we're here to talk about today is productivity. Now, productivity may have a negative connotation, and many of you probably just hear that word and it strikes fear through you. And this is because throughout history, productivity has gotten a bad rap because of situations with consulting companies that have done slash and burn reductions in force. Productivity should be seen as a positive thing. Don't we all want to do better each and every day? At its heart, productivity really measures the efficiency and production that you have and is a measure of the inputs to outputs. So when we're talking about productivity, workforce optimization, we're really talking about maximizing the inputs that you are putting into a particular output. In healthcare, those outputs can vary. It might be a patient day, a patient discharge. It could be a worked relative value unit if you're in a physician practice. It may be a patient encounter, a charge, a registration. Anything that you are doing in your day-to-day work can be quantified, and then we can calculate the inputs that are put into that. Why do we need to measure productivity right now? Well, number one, reimbursement is changing, and it's changing day to day. We know that we're moving more and more towards outpatient reimbursement methods and value-based purchasing. And as this happens, it's going to be more and more important that we have optimized labor workforce as well as productivity at every step of the way. And right now, the most important reason to optimize your workforce and to have a productivity engagement is the pandemic. Not only for how you're responding to the pandemic currently, but how you're going to respond and recover from the pandemic at the tail end of things. For those hospitals that have been very prepared, they were able to reallocate resources and take them from areas that do not have as much volume right now and put them towards their patient care units, train people in the ICU, and make sure that they're volume flexing their staff according to their acuity and volume level. It's also important with a lot of the population health initiatives. There are big movements happening right now to make sure that we're all taking steps to move towards managing the chronic care conditions. And as we work towards managing the diabetes, CHF, high blood pressure that our patients have and are presenting to us with, we're going to have more and more opportunities to have a population health initiative where we're proactive instead of reactive to the needs of our patients. And as this occurs, there are lots of growth needs that we all have, as well as capital needs. So why is productivity important? Why are you here today? Why did we choose to do a webinar on the 12 days of productivity? Productivity is important because labor costs are growing, and they are growing exponentially. For those of you that are participating or listening to this right now, if you've been doing agency nursing or sourcing agency nurses, you may know that the cost of an agency nurse last year was 1/3 the cost that it might be right now today. It's risen exponentially in the wake of the pandemic, and there are varying forces. So we know labor costs are escalating. We also know that in order to make sure that we are providing the highest possible quality of care, we need to understand that strong performance and real accountability drive the changes that we need. And as we continue to shift the landscape and move from volume to value and really embrace value-based purchasing, the only way that your organization is going to be able to do that is to ensure that you have the lowest possible cost of care at every single step of the patient care process. And the only way you can do that is to have productivity and improved workforce optimization in every area, starting from the time the patient interacts on the phone with someone that's trying to schedule their appointment, all the way to the endpoint where you're processing the bill, getting it out the door, and collecting on that payment. And everything in between needs to be optimized in order for your organization to make sure that you are prepared for value-based purchasing. So what does productivity mean to you? It's a system-wide focus on efficiency with a culture of accountability. And at the end of it, the most important thing right now is it's going to provide your hospital, your healthcare organization with job security for all of your employees. It also will give you the necessary dollars to reinvest in technology and equipment so you can have increased opportunities for your staff. It will help you improve service lines for your community so that you're able to improve your patient care experience. Now, productivity doesn't mean the same thing to everyone. It's going to vary based off of the department or the area that you work in, as well as your role. For example, if you work on a nursing unit, productivity workforce optimization is really about making sure that you have the appropriate nurse to patient ratio, tech to patient ratio. It all shifts during the day to respond to your patient needs and acuity based off the day of the week and the actual needs that you have. If you're in a dietary or ancillary area, you're going to really be focused on understanding the different peaks and valleys in the typical volume responses that you have throughout the day and assigning a schedule that's going to meet those needs, whether it's delivering to the inpatient floors or it's actually opening up the hours whenever your patients and visitors and staff really need to come through your cafeteria. You need to understand all that and flex your staff accordingly. If you're in an administrative area or an area where you're typically providing fixed services, it's going to be more of a budget response. So in cycle with your budget year, you're going to identify the proper resources and then move towards improving those resources and understanding those resources, because your work's not changing day to day. It's really based off of what you need and how you develop that on a fiscal basis. So now let's really get to the heart of the matter and the reason that we're here today, the 12 days of productivity. Day number 12, drumming up activity. Hey, productivity is not only for the organizations that are failing or the organizations that are struggling financially or for organizations that think they need to improve. Productivity is for everyone. And sometimes we really have to drum up our own activity and drum up our own excitement. And with this, it's important for every hospital, healthcare department, healthcare organization to routinely understand where you have opportunities against other similar best practice facilities and what you may be able to do to improve. It's important that leaders should frequently meet with their staff to determine the challenges that they have and have solutions to actually change and influence those challenges to perform more efficiently. Opportunities can range from eliminating small steps in a process and rework within a department to enhancing and cross-training your staff. A lot of departments and hospitals right now have cross-trained staff from departments within clinic practices to serve patients on the ICU. They've taken physical therapy staff and trained them to check in patients at the front desk to make sure they're complying with COVID restrictions. They've retrained people within other areas to support respiratory. So retraining and all this can drum up activity. And one of the things to keep in mind right now is the more proactively you approach your response to the pandemic response or to your department in any year will determine what you're able to achieve. A few key stats for you to know. Only 33% or 1 out of every 3 hospitals or short-term acute care hospitals have a compensation ratio that's greater than 50%. 1 out of 3 have a compensation ratio where they are spending more than half of their revenue on their personnel expense. In addition to that, 12% of those short-term acute care facilities have a comp ratio between 45 and 50%. This means that roughly 42-43% are performing at a level where they need improvement right out of the gate. In general, if your organization has a comp ratio greater than 43%, regardless of what industry of healthcare you're in, you need to address those numbers. And we'll talk a little bit later about what the compensation ratio actually is. So now let's move into day 11, piping into performance. So how do you know when you have to make change and how do you really pipe into performance improvement? In order to make continuous improvement, it's critical to know where your existing performance falls relative to historical trends. So the first step is to understand where have you been and how do you compare to other organizations? To do this, you want to track key performance indicators, often referred to as KPIs. And by tracking KPIs, you're going to be able to establish goals for your organization and then work to achieve those goals. KPIs are often used for comparative purposes to assess performance against other organizations within the same region, state, or a select group of peers. There are a lot of different areas of piping into performance and key performance indicators. They'll start at the top, which means the first thing that we're going to really understand are global KPIs or global key performance indicators. These are going to track the overall performance of your organization. They may be stats such as your overall length of stay or your operating margin. It could be the compensation ratio, which we referenced earlier. In addition to the key performance indicators at the global level, you're also going to have service line KPIs. These might be in areas that you're responsible for that are more functional areas such as revenue cycle. They might be emergency department specific indicators, or they might be indicators that you're providing for all of your physician practices. These indicators are more based off of those service lines and deal with things like patient satisfaction, readmission rates, quality scores, the length of stay that your patients are in your individual service line, the amount of patients you're able to secure each year, your growth. And then finally, there are departmental KPIs. These KPIs are areas that are specific to your actual individual department. They could be productivity related, or they could be related to things such as door to discharge time within the emergency department. It might potentially be a utilization rate where you're working towards understanding how much of the community is actually utilizing your services. They might be the amount of time it takes to register a patient within your clinic. Anything that you have, you need to have global, service line, and department metrics to appropriate pipe into your performance and to track your performance level. A few key performance indicators that are tracked often in healthcare are full-time equivalents per adjusted occupied bed and paid hours per adjusted discharge. These are the two most common global productivity indicators for hospitals. To calculate the FTE per AOB, you're going to start by taking all of your full-time equivalents within your organization and take the total hours and divide by the hours in the period. Typically, we assume there's 2,080 hours per employee. So add up all the hours that you have within your area, divide by 2080, and that gives you your full-time equivalents. You then divide by your adjusted occupied bed. The adjustment factor applies an adjustment to all of the inpatient activity to account for all the outpatient activity. And that adjustment factor is going to compare you on even footing to other similar organizations. And again, take the full-time equivalents and divide by the adjustment factor times the occupied beds. To do the paid hour per adjusted discharge calculation, it's very similar, except we're going to now start with the total paid hours and divide by the adjusted discharges. Again, the adjustment factor is a ratio that understands the ratio of the inpatient and outpatient revenue and applies it to your actual discharges. In addition to volume-related metrics, it's important to understand what you're performing with on expenses and revenue-related metrics. The most important metric that any organization should be looking at is your compensation ratio. And the compensation ratio only works if it's calculated appropriately. And what this means is you need to capture all of your personnel expense. So you take your total salaries of all employees that you're paying, as well as the total benefit cost for those employees, and add on top of it any outsourced expense, agency expense, or other related personnel expense that you have for your employees. This gives you your total personnel expense. We then divide that into our total revenue to understand how much of every single dollar are we spending on our people. That's going to give you that compensation ratio. You may recall during day 12, we talked about the fact that if you're at above 43%, you really need to focus on performance improvement metrics. But I'll tell you what, some of our clients that focus on always improving are lower than 40%. And right now they're sitting there talking about how can we get it to 39%? What can we do to still provide high quality care at 38%? How can we be in the top 10% of CMS performance at 37%? So as long as you're constantly reviewing this, the compensation ratio will be the #1 KPI that you look at. Very closely related to this is the revenue per FTE. The revenue per FTE takes the total revenue that an organization has and divides by the full-time equivalents. This tells you how much money are you collecting on every employee that you're paying. And I guarantee you in some cases, it's a lot less than you think. If this is coming in somewhere below $100,000, you're really going to need to be focused in what you can do to elevate that against the actual cost per employee. That gives you 4 different global compensation ratios and other KPIs that you can address for your organization. When we're looking at leaping into comparative analysis, which is day 2, this is very closely related, because in order for us to leap into comparative analysis on day 10, we need to develop out a customized peer group. And the customized peer group is going to provide us for a platform for comparing our organization against global comparisons and against other departments. To do this, we typically are going to look at the state, the region around us, the nation, as well as a customized comparative group that is specific to our organization. This means specific in size, service, structure, and this will help us generate the right peer group. So there are a lot of different criteria to consider when you're determining who should be in my comparative group. What do I need in order to compare appropriately to some other organization? Well, #1, you want to have specific volumes. You want to make sure that that organization is within the range of volume that you have. It is impossible to compare a critical access hospital to a large academic medical center. It is impossible to compare a family practice clinic in a rural area to an urban clinic within a city. You need to make sure that the volume is specific. Along with this, you want to understand the complexity of the patients that you're serving. This means you're going to look at the total services that you're offering and be similar to those. You're going to look at your case mix index to make sure that that matches as well. And you might look at your payers. There's a difference between an organization that has 60% Medicare and Medicaid than an organization that might be 90% Medicare and Medicaid, or if you're really lucky, 40% Medicare and Medicaid. We also want to make sure we're looking at geographical range. So we typically will draw a zip code range around the zip code and go out 200, 300, 400 miles to make sure there are enough facilities that compare to you. And most important is take out all the poor performing facilities. You don't want to be compared to facilities that are losing and have a negative financial margin, have poor quality results, and aren't performing well in patient satisfaction scores. Get them out of the mix. Remove them from the group so that you ultimately end up with a right peer group for you. This means that you want to look and search for information according to the criteria listed previously and remove all poor performers and outliers. Take out outliers that are not similar to you in outpatient percentage. Take out outliers that are not familiar to you or not similar to you in acuity and move them out of the mix. And then finally, to be mathematically and statistically significant, you want at least 30 facilities to be within the group. This is going to give you a comparative group that resonates and allows you to leap into comparative information. For day 9, we're going to let strong performance take the hold. This means that we are going to examine all the departmental performance. So in order to make sure that we're letting strong performance really take the lead, we're going to review global department performance as well as departmental metrics and individual employee performance. This is going to allow us to progress towards our goals systematically and ensure that it correlates to our overall organizational improvement. We have to make sure that our individual employees are working towards goals that align with our department goals, and those department goals align with our overall global standards and our organizational goals. And if we're able to do this, we're going to have alignment between our strategic plan, our financial budget, and our individual performance at the department level. Executives need to recognize efforts in these areas and make sure we're making significant strides towards the end goal. The only way to instill accountability in your organization is to make sure that there's a commitment to improvement, a commitment to productivity, and that leaders are walking the talk. If you want your individual employees to be held accountable to their goals, you, as the CEO, as the CFO, as the department manager, have to hold yourself accountable to your goals. If you're not leading from the top, you're not going to be able to allow strong performance to take the hold and inspire the individuals working below you to improve. Teamwork makes the dream work. We are all in this together, and that's never been more important than right now. There is no I in team. Collaboration is going to be necessary for a great experience and a positive outcome. If you have siloed operations and your employees are working in little quarters and not connecting and collaborating and working together, you're going to have gaps that lead to errors and inefficiencies. Remember, the most productive staff are going to be those staff members that work together well and work together as a team. One's responsibilities do not end when a coworker shift begins. We have to make sure the handoffs are appropriate, that we're staying in communication with our team members, and that we're never dropping the ball. Productivity is a direct reflection of the staff's ability to flex the volumes, work smarter, not harder, and function as a team. And because of that, productivity is a direct reflection on your ability to manage your team members. Letting strong performance take the hold is day 9. And day 9 is focused on creating that cohesive team. And in order to create the cohesive team, we're going to make sure that we're respecting our team members so that we're mindful of each other and willing to assist each other. This makes sure that we're providing the best of our ability and coming to work energetic and focused on the tasks at hand. We're also coming to work ready to provide the most appropriate patient care that we can in a flexible manner. While everyone's going to have primary roles, we need to be flexible and adjust to those roles. We cannot stand around and say, that's not my job, that's so-and-so's job, that's not my responsibility. We all have to make sure that we do our primary roles and meet our primary objectives and the tasks in our job description, but we have to step up and support the organization when they need us, where they need us. With the pandemic response right now, this is extremely important to make sure that we're all responding to the best of our ability. And in order to do this, we need to have equity across the board. Everyone needs to be treated the same, from the top of the organization at the executive team level, all the way down to the individual employee at the department level. And we have to have pride in what we do. Build your team up and build each other up by recognizing work. When someone's gone above and beyond, reward them, call them out, share information, and let them know that you understand what they did and how important it is to your end objective. This brings us to day 8 in the 12 days of productivity. Day 8 is milking the cost savings. How are we going to milk the cost savings so that we can improve our organization and drive productivity overall? Number one, in order to do this, we need to recognize and understand that high-performing, productive organizations and high-performing organizations from global perspectives are able to drive higher clinical performance as well as higher and improved patient experience. When you're focused on outcomes and you're focused on performance improvement, and you put the right people in the room to start talking about what you can do to improve your services, to improve your patient outcomes, to improve the care that you're providing, you're going to naturally drive clinical improvement. You're going to naturally drive higher patient satisfaction, which will inevitably improve your efficiency and productivity. And guess what? When you improve your efficiency and productivity, you are giving job security to your employees. Productivity is job security. Productivity will generate all of the monies that you're able to give to your employees for raises. It will generate all of the money that's available for bonuses, because guess what? We're not getting it from improved reimbursement in healthcare. It only comes from improved efficiency, improved productivity, and performance improvement. So keep this in mind as you're working to raise capital for new equipment that you need and or to working to help your organization enable your mission. There is nothing more important to help you generate money to reinvest than milking the savings that you can by reworking steps in a process, by improving the process, and eliminating any mistakes that you have along the way. Right now, the median facility is spending roughly 80% of every dollar collected on personnel expense. Best practice compensation ratios are 38% or 38 cents on the dollar, and better performing is 42 cents. What can you change to move closer to those goals? What can you do a little bit differently tomorrow to get closer to those numbers? Whether it's to reduce the amount of waste that you have within your supply chain, or to improve the amount of collections that you have within revenue cycle. What's going to get you closer to that end goal? And by reducing your overall compensation ratio, hospitals, healthcare systems, healthcare departments can have significant savings that can go back to your staff in the form of raises, benefits, improved bonuses. It can go back with new equipment, technology, and more important than anything right now, help you recruit staff members to embrace your mission, deliver care to your patients, and retain them over the long haul. So now let's talk about day 7, swimming towards progress. So the only way anything ever improves is to change. We cannot change by being comfortable. We cannot change by staying the same. We need to make sure that we are not treading water and we keep moving forward. For this reason, it's critical to establish the right goal or target to realize change and ensure progress. So how do you establish the right goals so you can swim towards progress? Targets should not be the same for everybody. You cannot expect every department to be at best practice or every department to be at better performing. You need to understand how each area is performing relative to the baseline and then make changes against the comparatives. We want to make sure that all targets are realistic and achievable and understand that performance improvement is a journey. We took 3, 4, 5, 6 years to get to where we are today. We're not going to improve overnight, but we want to make sure that our targets do reflect meaningful changes and that they're not too overwhelming or aggressive. In other words, we need to learn how to set realistic targets to swim towards progress. This does not mean setting a target at where you currently are. If you set a target at your current performance level, you're not going to improve. If you set a target that's actually worse than your current performance level, you're not going to improve. Nothing ever improves by staying average or by staying the same. So often a way to move towards improvement is to use a decision rule. A decision rule establishes a percent change based off the performance of the individual department relative to comparatives, such as the median, better performing, and best practice. This is the most effective approach because it ensures that all departments are contributing to your overall operation and financial goals of the organization. By doing this, all areas are given meaningful targets that are going to encourage a staged approach to meeting the end goal. A decision rule can be customized based off your strategic plan, based off your opportunities for improvement, and understanding where you want to go. The decision rule is going to ensure staffing changes and reductions in work hours are data-driven and where the most opportunities exist. Once you understand what you're going to do to swim towards progress, we are now going to focus on day 6, laying down the groundwork. Day 6 out of our 12 days of productivity focuses on effective implementation. Effective implementation is data-driven decisions based on volume, staffing, and performance trends. By focusing on the data-driven performance metrics, all goals are updated so that strategies, timelines, and actionable steps are needed together to achieve them. This really focuses on a collaborative process that involves all layers of staff and management. In order for us to lay down the groundwork, we have to make sure that we have both a top-down approach and a bottom-up approach. What does this mean? Well, from the top, the executive team, the senior leadership team needs to understand the overall goals of the organization and funnel those goals down through all levels of management. This means that the individual department members have to understand the why, understand the goals, and be part of the action plans to achieve those goals. So by having a top-down, bottom-up approach, we can funnel the goals down from executive leadership, engage our teams, and work towards performance improvement. We do this through action planning. Action planning is a systematic function of making sure that all departments are fully dedicated to the process and use a strategic framework to critical in realizing the targets. Action plans and tools are designed to develop specific, measurable objectives, as well as prioritize the outlined objectives. We need to provide a detailed step-by-step process and list of tasks to achieve the goal. So again, it needs to be measurable. Saying we're going to improve our volume is not a measurable specific goal. We are going to improve our volume by 5 patients per week. That's measurable. You can hold your team accountable to that. And as we're doing this, we also want to make sure that we're managing our goals effectively and monitoring progress against those goals. Again, develop specific, measurable objectives, prioritize the outlined approach, provide a detailed step-by-step process, manage the goals efficiently, and always monitor the progress against those goals. And as we lay down the groundwork and make sure that we have a successful action plan, we have to own it. If there's not ownership of the plan by you, by your executive team, by the senior leadership team, no one at your organization is going to follow it. One person must be responsible for tracking the progress. So you need to make sure you have a stakeholder that's responsible for the project, but everyone has to own the outcome and ensure timely action steps against the outcome. We need to make sure there's clarity in the plan. If we're going to communicate the why and communicate the plan to others, we have to be clear on the objectives. So the steps must be actionable and people must understand what role they have in achieving those goals. They cannot be vague action steps like reduce by 1 FTE. They need to be specific. You also need to have metrics that are going to help you know, are we working towards the goal? Are we not working towards the goal? Each action step must have a value metric tied to it that indicates the efficiencies that will be gained once the action is completed. If you're working in a physical therapy department, how do they know that they've actually achieved the goal? How many patients did they see per day? How many worked RVUs do they have per patient? Make sure you're defining the metric and holding your staff accountable to it. And finally, you need to have milestone dates. In order to work towards the endpoint, you have to have a date to achieve the goal. And by doing this, you've held everyone accountable and day 4 is complete. Which brings us to day 5. Include everyone. Productivity is full circle. No one can be excluded. So on day 5 of the 12 days of Christmas, we are focusing on including everyone in our circle. Collaboration is going to be necessary for any improvement project. This means you have to have a steering committee that's responsible for the outcome. And the steering committee needs to involve everyone. It has to have representation from nursing or clinical areas. You need representation from your people or HR. It needs to be financially linked and have someone from finance involved. You need to make sure you're focusing on the patient experience and quality. And if you have physician-owned practices, make sure the clinics are at the table. And finally, administration needs to be part of the process. And by understanding and making sure that you have all facets of the organization touched, you are then able to help with the dissemination of roles and expectations and ensure that everyone's involved in the process. When we're including everyone and everyone's within the circle, all levels of management need to be involved. We need to make sure that we're conveying information to everyone and engaging the staff effectively. This requires all departments to participate. We cannot improve performance by saying these 10% of departments are excluded. They've done too well. They're just going to stay the same next year, and we're not focusing on what they can do better. We're only focusing on these poor performers and drawing attention to the poor performers. That's not going to elevate your experience and elevate your performance improvement initiative. Make sure everyone is involved. Make sure everyone is held accountable to improvement. But if they're already at best practice, their goal may just be smaller. Also, make sure all hours of your staff members are included. We can't segment pieces of our team and say they're not part of it. So we have to include our direct staff members that have direct patient care, all of our indirect staff members, orientation, education, administration, as well as non-traditional roles and responsibilities. While we're doing this, stay focused on your core staffing levels because we have to understand what those core staffing levels are and understand that non-traditional FTs and functions may need to be further evaluated. Once we've set up all of those things and we've involved everyone in the process and we have come full circle, we now are at day 4 on our day 12 of productivity journey. And this is the call for better communication. And this often is a step that is probably underrepresented in our project rollouts. We need to start with communication. In order for you to understand productivity and get results, start with the why. Make sure that with your productivity initiative, you are having strong communication conversations and that you're sharing why this is critical to the success of your hospital or your healthcare entity. Make sure that a solid understanding of the why is communicated to all stakeholders and you share the how. Not only why you need to achieve these goals, but how are you going to go about achieving these goals? With clear and direct communication, You'll leave little room for uncertainty and make sure that you're having routine conversations across the board. This will keep everyone updated and focused. By having a call for better communication, we're going to create a communication plan that helps structure the timeline and the messages of our productivity initiative. It also will have a plan assigned to it that's going to assign responsibilities and make everyone understand what their role is, and leadership understand what their role is and what's expected of them. We're going to make sure that we have effective communication across the board, face-to-face, individually with our staff members so that they understand what's expected of them, at the group level, as well as written and electronic. One of the most successful communication plans are those that are going to use a variety of techniques and mediums to get the message across. Utilize email, roundtables, town hall meetings. You cannot communicate your message enough. You can never communicate it too much. And make sure you're communicating in all directions. You should be communicating upwards to stakeholders above you, as well as downwards to employees that are below you, as well as outward facing to the community, to different departments, and to your coworkers. Communication should occur continuously in all directions. And with the call for better communication, we're going to wrap up day 4 and understand that one of the biggest mistakes with productivity engagements is poor communication or no engagement and communication at all. All too often, we will have clients that fail to communicate the productivity engagement, or they try to hide it. And when they try to hide that we're focusing on performance improvement, rumors and gossip get started and people start talking. Here we go again. This is the same as that productivity engagement we had 10 years ago. I know a reduction in force is just around the corner. They say it's different, but I know it's not. When communication efforts fail, staff lose sight of the purpose of their work, they lose sight of the why that you're making change, and they focus on the rumors. And when they focus on the rumors, employee dissatisfaction starts. Job security goes down, retention dwindles, because when staff are not properly informed, they speculate. So do not allow them to speculate. Stay in front of it. Communicate often, communicate always, and share the positive outcomes. Rumors and gossip spread faster than positive messages, so make sure that speculation and uncertainty are not part of your climate. We have made it to day 3 of our 12 days of productivity, and this is the best one for us because this talks about the 3-phased approach that you need to take to influence productivity improvement. Improvement in any stage is going to take 3 steps. Phase 1, understand where you're performing and how you compare to others. This lets you understand your current status, assess where you are, and identify where you have performance improvement opportunities. Once you understand where the performance improvement opportunities are, it brings us to phase 2. Optimize your process, put in place action plans, and work towards achieving those goals. And as we're working towards that, phase 3 is we need to sustain those results and focus on continued monitoring and continued performance improvement. I hate to break it to you, productivity is never a one and done engagement. It is something that should be part of your culture year over year and become instilled in what you do every single year with your budget cycle. So as you take this 3-phase approach, it needs to be continuous. It happens annually. You understand how you perform against other similar peers. You develop comparatives. You then move towards goals that you establish against those comparatives that support your strategic plans and your operational goals. And then you monitor against those goals and sustain the results. This is a continuous process. Performance improvement goals should be updated annually. Ensure that the targets always link to your budget, your organizational, your strategic, and your financial goals. And then re-benchmark is necessary. You have to re-benchmark often. Has anything changed in the past year? If your organization is still using metrics from 2 years ago, or even 1 year ago, they are not going to be valid for your next fiscal year. So you need to re-benchmark, understand what has changed and how other organizations have changed, and then work to implement best practice approaches at your facility that are going to move you forward. This will provide you with your roadmap to success and your roadmap to your performance improvement journey. On day 2, we're going to focus on making peaceful progress through changes. So on day 2 of our 12-day productivity challenge, let's understand that change is a process to be enabled, not managed. We have to enable our staff, enable our department, enable our hospital to allow them to make changes, and then link those changes to performance outcomes and metrics. The only way we're ever going to address change systematically is to proactively change. And this starts with the executive level leadership. And it may be as simple as saying, look, we've had productivity targets in place for the last 3 years. We've had a system for 5 years, but no one's looking at those reports. That changes today. We're going to update our targets and start to hold people accountable to those targets. And when we do this, we're going to involve every layer of the organization and make the formal case for why. The why may be as simple as the pandemic and COVID-19 severely disrupted our operations this year. And the only way that we can proactively have a successful fiscal year next year is to understand those changes and put in place targets that we're going to need to be successful. And then communicate the change plan, allow leaders to own that plan, and move forward. There are tons of reasons that we have witnessed that clients do not make change, or that you may not be able to make change. There are also reasons that organizations fail. And as we work towards day 2 and making peaceful progress towards those changes, we have to understand what might prevent them. Number 1 is ego. You know, when we're looking at our ego, a lot of times as leaders, we want to take responsibility for all of our successes and push the failures off on our team. It's not my fault that we failed. It's all those other people. But keep in mind, as the leader of your hospital, as the leader of your organization, it is your responsibility to put your ego aside and to raise up and lead by taking responsibilities for the failures and embracing your staff and allowing the opportunity to succeed and change. And by doing this, you're going to create a culture that allows you to break the status quo, move past the mold of what you've done, prevent being seduced by your past, and unite your entire team to work towards your end goals. It will eliminate competing priorities by focusing everyone on the end goal. It will remove analysis paralysis because you're going to stop saying, they're not like us, we're different, we can never get there, and start focusing on what can we do to get there. And when we've done that, we're going to eliminate the phrase that I hate the most and that my team hears the most. We do it because we have always done it that way. Well, why do you do it that way? I don't know. Stop doing things the way you have always done them and start to embrace what you can do differently. Why is change so hard? People are comfortable. We're in our routines. It was outside our focus areas. We need to make sure that we're comfortable learning and implementing new practices, and that change can take time and it's expensive. Nothing worth having has ever been cheap. You're going to need to embrace the expense of change, of new equipment, of providing new care for your patients, of putting wearables in your hands of your patients so you can monitor them at home. You've never made any progressive change without spending something on it. So make sure you understand the why, make sure you communicate the how, and move systematically towards peaceful progress towards change. In order to overcome your obstacles, focus your managers on making only 1 to 2 changes every single month. Sometimes we become overwhelmed with reaching a plan. It's too far away. I want to lose 30 pounds, but I can't even figure out how to lose the first one. We want to save $5 million, and we don't know how we're going to save the first 10. Start with small changes. And as you focus on those small changes, it only takes 1 to 2 changes per department, per employee, per month. And just imagine what you're going to have at the end of 1 year. And the most important thing when we're focusing on the 12 days of productivity, celebrate the wins. All too often, we get started on a productivity engagement and your hospital, your organization's gung-ho. We communicate to the board, we bring on a consulting firm, we have new benchmarks, we're chasing $3 million of efficiency. And then you never update the board. You never communicate to your employees the fact that they surpassed your goal and shot past it. You don't recognize the employees that were responsible. So the most important day is the day you celebrate your wins, regardless of how small it is. To chase the big lofty goal, we have to celebrate the wins on the step to the path and on that roadway to performance improvement. So make sure we're celebrating the wins. People have the innate ability to rise to a challenge when you provide them with professionalism and positivity. It's critical for healthcare leaders in today's environment to recognize the contributions of our frontline staff, the sacrifices that they are making, and understand that leadership needs to be focused on educating the staff. A little kindness will have the greatest impact. So encourage positivity through cross-training staff and making sure they have appropriate support in multiple departments. Maybe implement summer Fridays and allow people to take 2 hours off. Recognize them for their routines. Walk around your units right now with a snack tray table and rounding and give your frontline staff snacks. Sometimes all it takes is a protein bar and a bag of chips for someone to recognize it. Wow, someone understands what we're doing. Celebrate with pizza parties, ice cream, anything you can do safely right now. Make sure that you're promoting it. Put in place a star board. So you're putting pictures of employees and what they've done to realize your goal on that star board. Maybe have themed lunches where you're delivering lunch to some of the units based off their contributions. There are limitless ways that you can reward your staff. The only thing that's necessary is to make sure that you are recognizing them. So we've been through a lot of different things, ranging from day 12, where we drummed up activity, to day 1, where we're recognizing our staff members. So the most important thing is to understand productivity has key success factors. We need to have clear accountability on all levels, including ourselves. We need to align the strategies with the goals in our productivity targets. And then we need to make sure that we're integrating those targets and building cooperation among all layers of our organization. We want to establish consistent communication to reinforce our goals and make sure we have annual review of those targets. Targets from 2 years ago are no longer valid. We need new targets and benchmarks to make sure we know where we're going in the future. Identify your productivity champions at all levels and make sure we understand what we're going through. Look, I'm not going to sugarcoat this. 2020 has been a difficult year for all of us. In fact, I imagine that we are all counting down the days until 2021 arrives and until we get to the other side of the pandemic. We've gone through unprecedented and extremely challenging times. But right now, through productivity initiatives, workforce optimization initiatives, strategic planning, you can remain focused on the prosperity of your organization and encourage positivity among your staff. Ask them for their solutions to the current problems that you have, regardless of what they are, whether it's the securing PPP for all staff members, whether it's discharging patients to the right long-term care facility to continue their care outside their facility. Whatever it is, make sure that you're engaging staff and do it through your workforce management productivity engagements. This will allow hospitals and healthcare systems to become highly efficient and have a plan for recovery. Sadly, more often than not over the last 9 months, I have heard organizations say, we're just going to wait this out. we're just going to hold on. Even sadder, I have watched some of those organizations close and shutter their doors or declare bankruptcy. Do not be added to that list. Start today. Understand your plan for recovery on the back end so that you can continue to deliver care to the communities that you serve. Understand your current state, set realistic goals, and communicate the why. By doing that, staff will understand why it's important to do it right now. You're doing it right now because you want to be here for tomorrow. It's not only important to have your hospital there during the pandemic, it's important to be there a year from now, 2 years from now, 3 years from now, so you can provide care to your family, to your friends, to your community leaders, and to everyone else. And finally, remember, you can become efficient at doing the wrong things. The solution is to become efficient and proficient at doing the right things. And keep in mind, right person, right place, right time for the right clinical outcome. And you can imagine all of the goals that your organization has ever reached. If you're looking for more information for Altius, please reach out. My contact information is on the slide below. And you can also reach any of my team members or through info@altiushcg.com. If you are looking for indicators right now to update your targets, to update your benchmarks, to revitalize your team in the wake of adversity, reach out. We're offering free strategy sessions to everyone that has listened to this webinar and participated with this webinar, as well as free comparative analysis for your organization. So make sure you reach out for your productivity indicator analysis, as well as a free strategy session, and we look forward to hearing from you. Thank you for your participation today, and we do have a few minutes for questions if anyone has those.
We do have a couple questions that were submitted today. The first question is, do you have any examples of a way that productivity cost savings were reinvested in a way that the frontline staff has felt the impact?
That's a great question. And we have some great examples of ways that productivity dollars have been reinvested with frontline staff. One of the best examples that I have is with the radiology department, where they were just working to chase best practice and working to chase best practice. And before they knew it, they reached their goal, but they failed to quantify what that goal actually meant to the organization in dollars. Even worse, they failed to recognize that when they purchased the new MRI and the new CT scans, the radiology department was ultimately responsible for helping the organization be able to afford that equipment. Another example of an organization that was able to deliver it back to the frontline staff is they were looking for ways that they could really solve their sitter problem. They had a lot of one-on-one care and a lot of needs in behavioral health areas. And they noticed that areas ranging from the emergency department all the way to the med-surg floors needed more one-on-one eyes on people. So they took their productivity improvements and reinvested it in cameras that could be positioned in all patient rooms in all areas so that they could, within a snap, see what's happening in that patient room. And this allowed them to be able to hear the call button, hit a button, see the camera in the room, and know I need to respond to this immediately because a patient's on the floor, or they're just looking for water and I can wait for 2 seconds and respond to the request. So by putting those cameras in, which were brought from the productivity engagement, that was a way it really supported the frontline workers. If you're looking for more, reach out. I'd love to give you 10 more best practices.
And what is your opinion or approach to a department that actually has a unique factor such as minimum staffing or positions that are traditionally found in another department?
So those are two different pieces. Number one, when you have a situation where you have minimum staffing levels, the first step is to really understand and identify what those staffing levels are at minimum staffing and what volume level supports that. That's really your baseline, and you're never going to go below that. So anytime you have a productivity indicator or report, you really don't have a variance if you're at that number. It's only when your volume goes above that. So even if you're not meeting the volume threshold, there shouldn't be a negative variance, and then you start to flex above that. You're never starting at 0, 0. It might be above 10 patients, we need more staff. It might be above 12 patients. Whatever it is, you establish that bar. If it's non-traditional staff, maybe you have someone that's working in the operating room and they typically work elsewhere. You want to quantify it and make sure you adjust your benchmarks, which are your comparatives, as well as your target for those non-traditional staff members. You don't need to move them because this is your appropriate care level. They can stay where they are, but you don't want to adjust them and assign them to other areas without adjusting your target and adjusting your comparatives. So understand the non-traditional functions, understand what makes you unique, and adjust accordingly.
And one last question. My productivity report tells me my current performance, but how do I impact that number?
Great question. So it really depends on whether you're the individual employee, the director, or the executive. The step on impacting that number first is to understand the performance level that you're at and where that is, whether it's below median, at best practice, what it is, and then quantify what it's going to take to improve. So maybe you're at 8.9 hours per patient day or 50 minutes per procedure. What would it take if I were to try to get to 48 minutes per procedure? How would I do that? Are there minutes that I'm taking registering a patient that could be shaved off? Is our process of taking a patient from the waiting room back to the room cumbersome? And can I influence that? Is our telehealth check-in process clunky? And I can buy technology to help me actually implement that in a better way. You influence by understanding, identifying where you need to change, and then taking action steps towards achieving that. And finally, if you're moving down a path and it's working, embrace it and continue. If you're moving down a path and you're thinking, oh, that was a great idea, but it's not working, you want to step away from it quickly and try something else. All right. Thank you all for participating today. I had so much fun sharing the 12 days of productivity with each of you. Again, if you're looking for more information, please reach out to us at info@altiushcg.com. My staff and I are here for all of your workforce optimization, productivity, and labor management needs. And I wish all of you a safe and healthy holiday season, and I hope you're able to enjoy it with family and friends. Thank you.